Do you use epithelial pachymetry maps for your diagnosis?
I always use epithelium pachymetry because I use it before doing a LASIK, for instance. I use it after a LASIK, for instance. I use in all my dry eye patients because we know that in case of hyperosmolarity, we may have apoptosis. In case of apoptosis, we may have a dishomogeneous epithelium. So we may have some areas where we have a thicker epithelium, in other we have a thinner epithelium. So I think that this information is very useful for us in order to understand if our patient is suffering from dry eye disease or not, and gives us information about also the surgery and the outcomes.
Carlos?
Yeah, me too. I think it's critical. For me, it's a very interesting tool. We need, especially for the keratoconus frustra, for instance, and we use the pachymetry and also the quality of the epithelium. I think is very, very helpful. So completely agree.
I don't use it, but because I'm mainly clinical. But I think it can be very interesting to see, because you have two kind of modifications. You have the thinning of the superior cornea, which is probably related to the friction of the lid onto the cornea, and you have also a thickening of the epithelium of the inferior cornea, which can be related, as you say, to the tear meniscus, but I think it's mainly related
to toxicity of drops,
or to the partial blinking. So patients who have partial blinking, probably that they don't rape their inferior epithelium, and they will have an increase in this in this area. So it could be interesting to try to correlate what you see in your pictures and the clinical observation of either a partial blinking and either, for example, a lid wiper epitheliopathy, which will be related to this. But I'm mainly clinical more than this kind of image, but it's very nice.
And you, Orlando?
No, I haven't used it, so this is good. You know, this is why I come to the meetings. Take something home with me, so I'll take this home and I'll start looking.
In Europe, we use it, so now I have to cross the ocean.
Okay.
In the United States, it would be...
our research coordinator's here. She's got another
It's very
project.
interesting information from OCT,
Yeah, nice.